A patient was referred to me 6 months ago. As you can see right here, 4/22/2024, and today's date is 10/29/2024. So 6 months ago for evaluation of tooth number 30. According to the patient, this root canal was done about 10 years ago, and the patient said she really didn't have much symptoms associated with the tooth. So take a look here. You can see crown on the tooth, previous root canal, periapical lucency here, and apical root resorption. It's important, as I always tell you guys, it's very important, extremely important, to not rely on just one angulation PA for diagnosis. Always take multiple angulation. So let's look at multiple angulations of this tooth number 30. Look at this angulation. You can see the large periapical lucency here. What is that? Right there. That's a broken file. That's why this mesial canal was obturated short, because when the dentist was doing the root canal, he or she broke a file in that canal and couldn't go to the apical terminus of that canal anymore, because that broken file was obstructing the other files to go to the apical, the working length. All right, the apical terminus of that canal. That's why it's important to take multiple angulation PAs, so that you know what's going on and you would know what you would be getting yourself into if you try to redo the root canal. All right. If you didn't have multiple angulation PAs and you just relied on this angulation PA, you wouldn't have known that there was a broken file in the tooth. And who knows, maybe you would have been blamed for breaking a file in this tooth. But now that you have multiple angulation PAs and you see that broken file there, you document it. So everyone now knows that it was not you who broke this file here. It was the previous clinician who did the root canal. And of course, now you know what you're getting yourself into also. Now you know the type of treatment that needs to be provided for this tooth, the kind of endodontic retreatment that needs to be provided for this tooth. Huge periapical lucency. Anyways, I discuss options with the patient. Redoing the root canal with guarded prognosis, about 80% chance of success. Let the patient know I may not be able to remove that broken file. I would do my best to try to bypass it. No promise or guarantees. In the process of removing or bypassing the broken file, this broken file unintentionally might get actually pushed to the outside into the periapical area, causing complications. I always go over all of this with my patients. Make sure that when they sign that consent, the consent is actually informed consent, and all the risks are discussed. Also went over the alternative to redoing the root canal. The alternative would be extracting the tooth. This patient is very young. She is in her 20s. And she said she did not want to extract the tooth. She wanted us to try to see if we can save it for her. And again, it was 6 months ago. As you can see, today is 4/29/2024, and this was 4/22/2024 when I saw her for a consultation regarding this tooth. So we scheduled the patient. She came back, and we redid this root canal for her in one appointment. And take a look. Went through the crown and redid the root canal in one appointment, and take a look. Also, by the way, I requested x-rays from her previous dentists. All right, these are all the x-rays they sent me from 2018, 2019, 2020, 21, 22. And look at the x-rays I got. This is one dentist, sends me a bite wing from 2018. These x-rays are from 2018. Sends me a bite wing, another bite wing, or it's not a bite wing. It turned out to be kind of a bite wing. They wanted to take a PA, but look at their PA. Look at this one. Look at this PA. But you can still see the broken file. But you can't see the periapical area. What kind of PA is this, sir or ma'am? You know, how would you allow your dental assistant to take a PA like this and not correct her or him? Come on, you're the team leader. What kind of FPA is this? This dentist should have immediately either taken the PA himself or herself, or corrected the dental assistant and asked the dental assistant to give him or her a better PA. I mean, what kind of PA is this? What kind of PA is this? Look at the other dentist. I call another dentist, I get another bite wing. Where's your PA, sir? Another bite wing. Another bite wing. I called a few dentists that this patient had gone to, and they all sent me PAs. Anyways, I don't know, man. I don't know. And this is the United States of America that we're talking about. Dentists in the United States of America. I'm not talking about dentists in other countries. This is United States of America, and our patients, no matter where they are, they deserve better. Anyways, so we went ahead and redid the root canal for this patient. I showed you apical root resorption as well. So I was able to remove actually that little tiny broken file there. All right. So these are, I had to go through amalgam, and I think as I was going through the amalgam buildup, some of the amalgam buildup, just the little bits and pieces, got inside of the canals. But they'll be okay. They'll be okay. There's a piece here, there's a piece here, another piece here. So I was able to bypass or remove. I think I removed it, but it may still be there. But regardless, I was able to regain patency in the canal that the broken file was in. Again, you can see that large periapical lucency. The distal canal, I don't know. Maybe there was a small periapical lucency associated with it. Maybe not. But I retreated the whole root canal here. Again, you can see that I was able to regain patency. Maybe that's the broken file there, but I was able to bypass it. And again, you can see the large periapical lucency here, very large. That's another angulation of the immediate post-op, right after we had redone the root canal for this patient. Again, you can see the large periapical lucency here, and the fact that I was able to regain patency in all the 4 canals. And again, here's the date, as you can see, 4/29/2024, and today's date is 10/29/2024, so exactly 6 months ago when we redid this root canal for this patient in 1 appointment. Now, will this root canal fail? Root canal retreatment fail because I redid the root canal in 1 appointment? Should I have redone this root canal in multiple appointments, as some of you so strongly feel? That's one question to you. The second question is, will the extrusion of the sealer in the apical area cause endodontic failure? Will sealer extrusion cause endodontic failure? Sealer puff, sealer extrusion cause endodontic failure? Let's take a look at the 6 months post-op of this tooth. And again, here's the date, 6 months ago exactly. Today's date is 10/29/2024, so exactly 6 months ago when we redid this root canal 1 appointment. And patient came in for her 6 months post-op, and take a look. Here's the 6 months post-op of the tooth. Look how much smaller that periapical relucency has gotten. Let me put the x-rays next to each other so you can appreciate. This is another angulation. You can see how much smaller the periapical relucency has gotten. All right, let's put the x-rays next to each other. X-rays from 6 months ago compared to x-rays from today that we took. So this is 6 months ago, before we redid the root canal for this patient. And here's the date, as you can see, and today's date here. Let's put them next to each other. So I'm going to minimize this x-ray and put it next to today's x-ray, a comparable angulation. And here we go. Take a look here. Let me zoom out so you can see. X-ray to PA to the left is from 6 months ago, and PA to the right is today. So you can see how much smaller that periapical relucency has gotten. That's 6 months ago. And this is today. Six months ago, today, and zooming out. So in 6 months, the periapical relucency has gotten much smaller, which means the infection is gone and her body is regenerating bone. If the root canal retreatment had failed, then the size of the radiolucency had gotten larger. But as you can see here in this case, this periapical relucency has gotten smaller in the past 6 months. So this is considered a successful endodontic retreatment. So me redoing this root canal in 1 appointment, this did not cause endodontic retreatment failure. Sealer extrusion did not cause endodontic retreatment failure. These are all fairy tales that we were taught in dental school. All right, so 6 months ago, today. 6 months post-op of tooth number 30. Patient has 0 symptoms, no symptoms whatsoever. Tooth is in full function, as you can see. Patient still has the same crown that I went through 6 months ago to redo the root canal. Her dentist just replaced my temporary filling with composite. Excellent. 6 months post-op of tooth number 30. Tooth is in full function. Patient has 0 symptoms. 6 months post-op of tooth number 30.